Guys, so the next skill we'll be doing is administering insulin. So we know that insulin is administered in your subcutaneous tissue. So we have the abdomen, we have the back of the arms, and we have the thighs part, the front of your thighs. So those are your sites that you can choose from. All right, so we know that insulin must be given in what? An insulin syringe. So please make sure that you have an insulin syringe, and they kind of made it universal for you that is normally orange, but the biggest thing is when you look on it, insulin is measured in units. So that's important. If you don't see units on the syringe, 9 times out of 10 you don't have an insulin syringe, and you must have an insulin syringe in order to give insulin. All right, so why do we mix insulins? We really just mix insulins just so we don't have to give the patients 2 injections. So let's say during your not doing your checkoff, because you must mix them during your checkoff, but let's say you're in the hospital and you can't remember what insulins you can mix. Well, when all fails, you would just have to give them separately, and that's okay. But during your checkoffs, you are required to mix your insulin. So you will be mixing regular insulin and NPH insulin. So we have a fast acting insulin, and then we have a intermittent acting insulin. So that is what's the difference. So one is going to kick in quicker, and then another one takes a while to kick in. All right, so first we want to look at the order. So this patient has an order for NPH, and it's 3 units, sub-Q daily. And then they also have a regular insulin order, but with that, they're going to use the sliding scale. So right before I was about to pull up my medication, I told my CNA to get the patient's blood sugar, and she told me that the patient's blood sugar was 232. So then I will flip to the back and see what the low dose sliding scale is. So if it says if the patient's blood sugar is 181 to 240, they're going to get 4 units. So this patient is going to get 4 units of regular insulin. So instead of giving them 4 units of regular in one syringe and 3 units of NPH in another syringe, we can mix them together. So when you're pulling your medications from the Pyxis, remember, we're going to do a check before pulling the medication and another check after we've retrieved the medication. And then a final check would be at the bedside. All right, so we're going to go ahead and perform hand hygiene. And we're going to go ahead and put on our gloves. All right, so what all do you need? So you need an insulin syringe, you need your insulins, and you need some alcohol wipes. All right, so first what we want to do is we want to clean the valves with an alcohol wipe. So we want to clean the top. So insulins are multi-use. So if you're in the hospital, you will actually share this vial with the rest of the nurses. So you can't take this insulin with you to the patient's room. But for your checkoff, you are allowed to take it to the patient's room. Alrighty. So one of the biggest things is with insulin is the expiration date. So we always want to make sure that we're checking to see if our medications are expired, especially when it comes to your insulin. So we're going to let that dry. All right. So then we're going to get our insulin needle. So we know that we're going to give that patient 4 units of regular insulin, and we're going to give them 3 units of NPH. So this part varies. So some books and some people teach that you can draw up the total number is 7, right? So we're going to give a total of 7 units. And when you're injecting your air, you will eject how much air that you're giving from that medication. So let me give you an example. So with the 7 units, I'm now going to add air into my NPH. So I know that I'm only giving 3 units of NPH. So I would just put in here 3 units, and you can measure it on here. All right. So I put 3 units of air in your NPH first. And then I went to my regular insulin, and now I only have, what, 4 units left in here. So you then can insert the 4 units here and then flip it over and pull out what you need. So let me show you another way. Another way, what you could do is, you know that you're given 3 NPH, so I could draw out 3. And remember, these are already clean. Insert it again, and then insert your air in there in your cloudy, and then I could draw up 4 and then insert it into your regular. So it's up to you which way, how you want to draw up your insulin, okay? All right, so we're going to start from right here. So I put air in my cloudy first, which is your NPH. So look at this. This one is actually cloudy. So that's the biggest difference between these insulins when it comes to looks. One is actually cloudy. So you're going to put air in your cloudy first, and then we're going to put air into your clear, which is your regular. So after you put air into your clear, you then flip it up and pull back how much insulin you need. So we're giving 4. So I'm going to make sure I have 4. All right, I have 4. And now I can go to my NPH to get my 3. All right. So then, so best practice is, especially when it comes to at the facilities, they really want you to be double checking your insulin with your nurses. So what you would do, especially in between, let's say when I first drew up my regular insulin, I would then have a nurse there and I would like, hey, can you tell me how many units this is? And she would tell me, oh, that's 4 units. And I would say that's correct. You never want to tell the nurse, hey, do you see 4 units? No. So you would say, what do you see? They will tell you 4 units. Okay, so that is 4 units of your regular insulin. Then after I drop the NPH, you then will have the nurse verify again and be like, okay, so now you have a total of 7 units. All right. So once you get to the patient's bedside. So now, once we're at the patient's bedside, we want to introduce ourselves to the patient. Hi, I'm Asia. I'm going to be your nurse today. I will be administering your insulin, and you want to let your patient know what their blood sugar was. So your blood sugar was 232 today. So you're going to get 4 units of your regular insulin, and your NPH insulin, you're going to get 3 units. So your patients who have diabetes and, they control their diabetes and stuff at home, they already know all this talk. But for your patients who don't know, be prepared to answer some questions with your patient because they want to know, why do I need insulin and things like that. So you want to be able to answer those questions for your patient. So then you ask your patient, do you have a preference on where you want it to go? They may say, no, sweetie, just put it wherever you want to put it. So wherever you want to put it at, you would just put it there. So if you're going to put it on the back of the arm, just tell me, I will go back here. If you want to put it on the stomach, say I will go in the stomach. If you want to go on the thigh, say that is where you're going. All right, so we want to take an alcohol wipe. Oh, and also, let me teach you the scoop method. So you are always taught in nursing school, never recap needles. But if we prepare this in the med room, because remember, we can't take these out of the Pyxis because we have to share them. So we then could recap your insulin needle in order to take it, to the patient's room. And you just don't want to be walking around in the hallway with a needle like that. So we can use the 1 scoop method where you lay your cap flat and then you scoop it on in there. And that way, your patient, you're not at risk for a needle stick. All right, so now we can set that to the side. All right, so now we want to clean our patient's skin. So you want to always let your patient know, like, hey, this is going to be cold. All right, and we're going to let it dry. We're going to let it dry. All right, so when it comes to angles, so if your normal angle for sub-Q injections is going to be 45, but if you have an obese patient, you can go at a 90-degree angle. So don't be afraid to get a good grip on your patient's skin when you're giving them their medication. So we're going to take the cap off of it. All right. All right, Miss Smith, I got your insulin for you. Are you ready? I'm going to put it in your belly. You may feel a little prick, but it won't last long. So you want to grip the stomach, especially with your stomach. Sometimes your stomach is all squishy and all that kind of stuff, so you're going to have to get a good grip on your stomach of the subcutaneous fat. All right, so you want to grip it like that, and you want to hold your needle at that 45-degree angle. All right, sweetie, this is going to be a quick prick, okay? All right, you want to put the needle all the way in the patient's skin and press down on the plunger. All right, sweetie, that's it. So we then want to activate our safety on there. We don't want to massage the site or anything. We just want to just let it be. Now, if you do have a little bleeding from your patient, you can take a gauze pad and pat it dry. But you don't want to massage the site or anything like that. So when you're giving insulin injections, you do want to tell your patient to rotate sides. Also, with diabetes is a chronic disease. So we want to make sure that we are teaching our patients how to do this so they can do it themselves. Alrighty, so we just went over how to mix insulin. So a quick little side note, let's say that you read your sliding scale and your patient's blood sugar was 150, and the sliding scale says that, not 150, let's say that the patient's blood sugar was 120. And let's say the sliding scale said that the patient didn't need any regular insulin. Well, guess what? Kudos for them. They just won't need any regular insulin. All right, so I hope this gave you a better understanding of how to administer sub-Q injections.